From the New Orleans Convention Center in Louisiana, this is the ASN Kidney Week 2017 podcast, a discussion of the latest scientific and clinical advances presented at this year's annual meeting.
Good afternoon, and welcome to Day 3 of Kidney Week 2017. This is Eleanor Lederer again, and today I am joined by three more of my colleagues to discuss the events of the day. Can you all please introduce yourselves for our listeners?
I'm Martin Pollak. I'm Chief of Nephrology at Beth Israel Deaconess Medical Center in Boston, Massachusetts.
And I'm Richard Coward. I'm a Professor of Renal Medicine from Bristol in the UK, and I'm a paediatric nephrologist.
I'm Devika Nair. I'm a second-year nephrology fellow at Vanderbilt.
Excellent, excellent. Thanks again to all of you for participating. Let's start with you, Dr. Pollak. As the winner of this year's Homer Smith Award, was there anything particularly noteworthy that you saw during the meeting today?
Well, a lot of things that were interesting. It was nice to see some terrific people recognized this morning as honorees. The various awards that were presented by the American Society of Nephrology to some very worthy people. I think Dr. Feinberg's talk on epigenetics was very interesting and well presented, and illustrates how important it is to try to always make the connection between what's going on in the basic sciences and the clinical world, and kind of introduce these concepts to a broad audience. And then a lot of interesting posters that I saw this afternoon. I mean, too many to go through in detail, but a lot of interesting things. And one of the subjects of interest to me, which APOL1 associated kidney disease, there's been a lot of progress and a lot of exciting insights. And it's always interesting to see when people you don't know come up with new ideas, new out-of-the-box thoughts and experiments that have the potential to transform and move the field and move things in new directions. It's always exciting. I just heard two nice talks, one from Stuart Shankland, another Jeffrey Kopp, on podocyte biology. I left early so I could get over here to participate in this little podcast session. But a lot of interesting and varied things today. Of course, it's impossible to get to all of what you want to see at such a large meeting, but it's been an interesting day.
Well, it sounds like you made the rounds, though.
I tried.
So, I think it's been another excellent day at the ASN. I think the thing I really like about it is that you can come from all over the world and have your different interests, and you can always find something that's going to be new and cutting edge. We were talking about it a bit earlier on that I've got a patient at the moment who's got primary hyperoxaluria type 1, incredibly rare. First time I've ever had a patient like this. And all you need to do is put it into the app. And yesterday I went to see a late-breaking clinical trial, which was unbelievable, where they're basically using effectively inhibitory RNA therapy on children to try and bypass the liver defect. So this is early stage. They've done phase 1 and phase 2 early stages, and it's going to the next stage now, which will hopefully go to our patients. And you could see it really changing their outlook. And for the children that I look after, and this particular child, I could see it be really, really relevant. It's also really nice, as we were discussing earlier on, that it brings people from all over the world to the ASN. So this work's been produced by people in Israel, people in France, people in the UK, and presented here in America. So yeah, it was really good. Excellent.
I think that's just an absolutely wonderful example of how the field is moving forward, and that sometimes the rest of us don't hear about it. And that's a major advance. That's a major advance, for a disease that causes kidney failure very rapidly in a very young person and can recur.
Absolutely.
Can recur, in a transplanted kidney, and so many times actually is not really diagnosed appropriately.
Well, you're absolutely right, and that's very similar to the patient that I'm looking after now. And this was a child who came to us at 4 months of age in end-stage renal failure, with a blood pressure of over 200 millimeters of mercury, and it took us a while to get to the diagnosis, and then we eventually got the diagnosis. And we're going to have to see what happens, but you can see that it's going to potentially revolutionise this kind of therapy, and it's all completely new biology. Thinking about going in and inhibiting RNA to go and bypass a kind of defect in the liver. So I've been coming to the ASN for about the last 10 years or so, and each time you see something new and something exciting, and that's definitely been my take home from this meeting, I think.
For me, as a younger trainee, and this being actually my first ASN, there's been so much that I've really enjoyed. Today in particular, I really, of course, enjoyed the morning session, the late-breaking clinical trials. That was really exciting and wonderful for me to see as a younger trainee, advances that are happening. There was another session that I really enjoyed that was actually occurring at the same time, so I didn't catch all of it, but it was about shared decision-making and different types of dialytic modalities and the science behind decision-making, which was a really interesting way to look at patient-centered care and make it very meticulous. So I particularly enjoyed that session this morning. And then again, for me as a fellow, today it was really nice because I got to connect with other fellows in the Communities Lounge and meet people from around the world, including in other disciplines such as pediatrics. I met several peds nephrology fellows, and it was just really wonderful to see young people who are passionate and excited about the field, and I think it bodes really well for the future. And lastly, I have to say I really enjoyed your talk that was earlier today. I haven't gotten to see it before, so this is my first time hearing it, and what I liked the most is that you were so open and kind of vulnerable, and it was very refreshing to hear your personal path that you've undergone, and it was a wonderful talk.
Thank you. Thank you. The late-breaking clinical trials, of course, are always, a very popular feature. This is, and I did not myself have the chance to go attend it, but walked by the audience and the room, and the audience looked huge. Looked like it was virtually full. So, yes. Happy to see that. This year, we actually received a very large number of late-breaking clinical trial abstracts, and for the first time, really had a difficulty, having to decide which ones to present and which ones in oral form and which ones to present in poster form. Mm. So I think just picking up the theme of things that are completely new. So the hyperoxaluria story, very, very exciting. Was there anything else that any of you guys saw that you thought, wow, this is way out there?
It's a nice, difficult question you've given us.
It's a difficult question.
So let me just reframe it a little bit then. Think about your particular area of interest. Is there anything that you heard in this meeting that you thought to yourself, this is at least a major advance, or this is the beginning of an advance that I can see coming up and maybe being even a bigger story later?
So maybe not along those lines, but something that's definitely, so I'm a pediatric nephrologist, but my research interest happens to be into diabetic nephropathy and insulin signaling to the kidney. And I think a major advance, which we heard at ASN a couple of years ago, was the SGLT2 inhibitors. So this year we've had a session which is completely a whole session of invited or abstracts that were presented, oral abstracts, and an expert talk. So we had a whole 2 hours on SGLT2 inhibitors. And I think that's really good because you could see where the field has got to in this short period of time. And I think the take-home messages from the way I got it was that they seem pretty safe. So I think there's potential there with them. There's still more work to be done to see which way they're going to go. And what I think is really interesting, which hopefully at the ASN next year or the year afterwards, is trying to work out the mechanism by which they work. I don't think we know how they work at the moment, and hopefully that'll get broken maybe next year or the year afterwards. So although they're safe, they look really pretty good for the patients, pretty well tolerated. I think we still need to do some work on working out exactly how they work, because that may lead to other therapies which are absolutely needed in diabetic kidney disease, because leading cause of kidney failure in the world.
Yeah, absolutely. So I remember it was just a few years ago, I think, that Ernie Wright actually got up and gave a talk on, how they had identified the transporter, SGLT2, and then, just the journey it took from identifying, cloning, and studying the transporter, then to the development of an inhibitor that now, of course, we have a whole slew of them, that are coming out into clinical use. So just to pursue that a little bit further, I guess simplistically you could say the SGLT2 inhibitors, they work because they block glucose transport. So what you're saying is that you're thinking that maybe there's a bit more to it than just, losing glucose in the urine?
So we know it can independently reduce the decline of renal function, independent of reducing your blood glucose and increasing your insulin sensitivity. So there's got to be a renal effect, I think is clear. What is it? We know that you drop your GFR in the first few weeks when you go on an SGLT2 inhibitor, and that obviously will decrease your amount of albumin in your urea, which could lead to it. I don't think we really understand, is it a lack of maybe sugar and salt going through the tubules and it's actual tubular toxicity that you're protecting against, or is it feedback going back from the tubular maybe to the juxtaglomerular apparatus and reducing, the load on the glomerulus? So I still think there is quite a lot to be done, and has it got any other targets as well? I think will be interesting in years to come.
I think it's a really fascinating story. I mean, diabetic nephropathy is not my field as a nephrologist. I, of course, take care of people with diabetic nephropathy, but it illustrates, I think, a few important points. One is the importance of basic science. Cloning these transporters initially without any clear goal towards a therapy, just trying to understand how the kidney works. And now, years later, it's leading to one of the most, I think, interesting and remarkable advances in therapeutics. And also just the fact that this therapeutic is having more interesting and perhaps broader effects than had been anticipated by most people, I think. So both, the importance of really basic science, knowledge, science that exists just to understand the kidney at a basic level is so important, even if the practical implications are not immediately clear. And the fact that, we should always expect the unexpected,
Yeah.
Expect the unexpected. I like that because it's just so true. I mean, you think you think you know what's going to happen, and then it gets out in practice, and then something else does happen. So Deva, I'm pleased that you enjoyed that series on decision making and the patient engagement, because for ASN this represents really a different direction that we're going in. It's not that we never had any symposia or lectures on topics like that, but they were pretty few and far between. I think we're incorporating more and more of that into the body of the meeting, certainly as we have begun to engage more patients. As you know, this year we did have patient-centered conference. Kevin Fowler gave a nice talk. So tell me how you think that maybe we could expand those types of venues.
Yeah, absolutely. And I think it is really nice to see that, but I think there's a good way to kind of continue to have the basic science emphasis while incorporating these types of patient-centered outcome-related talks. I think they really go well together. One thing that I really liked this year that I think was new were all the talks on qualitative research, which is a strong component of patient-centered outcomes, and kind of understanding the rigorous methods that can be applied to qualitative research, which I myself am just learning about. And I think making sure that there is the same amount of rigor that we know and apply to basic science, and ensuring that same type of rigor can be applied to things like qualitative research is really important. So I think continuing to have sessions that do involve real patients, patient advocates, people that are kind of across the spectrum of who takes care of patients. So in addition to physicians, maybe, including more nurses, things like that. Everyone has kind of a different opinion on how they can create comprehensive patient-centered care. And I think hearing everyone's take on how we can kind of come together to do that in a really systematic and useful way would be really useful. So I guess this was during one of the earlier clinical research sessions. That's when I got to hear this qualitative research talk. So having something like that in the future again, I think would be really great, because I didn't really expect that was going to be included in the 2-day clinical research course, and I think I got a lot out of it.
Great. That's fantastic.
Yeah.
Fantastic. So anything else, come to mind? Did any of you guys, after listening to Dr. Feinberg's talk today, ask yourselves the question, okay, so how is this going to apply to what I'm going to do?
Yeah, as a geneticist, I think I've probably ignored epigenetics too long, and I've got to really educate myself better. That's the broadest thing I got out of it.
So yeah, I think epigenetics are where it's at. So my research interest is diabetic kidney disease. We've tried really hard. There was a fantastic session yesterday talking about the genetics underlying diabetic nephropathy. Mark McCarthy, Matthias Kretzler, and other people talking. And what, again, the kind of take-home message there is there aren't any major genes coming out. Mm-hmm. It's got to be epigenetic modification in my book, because the environment's there with glucose, insulin resistance, and then the talk this morning was really good because crystallized all those different ways that you've got the same DNA code, but the way it's expressed is different in different patients. So it seems to me to make a lot of sense about the environment, and I think in diabetic kidney disease it's going to be really important. It's my feeling.
Yeah, I mean, I think that's one of the most interesting unsolved questions in nephrology. I mean, why do some people with diabetes, simplistically stated, why do some people get nephropathy and others not? And it certainly doesn't seem like it's standard genetics in a straightforward way. And I'm sure you'll figure it out, Richard.
I think so. I think what is good going forward is the big cohorts that we're getting in America and across Europe, where I think you need big numbers. You need really big numbers to try and work out what's going on, or to see whether we can start getting some signals out. Yeah. So working together collaboratively. Mm-hmm. Again, I'm English, and I think our links with Europe are absolutely critical scientifically, so I really hope we don't lose any of those. And I also think the links with America, Canada, and around the world are really important for these massive issues, actually.
Absolutely. Well, more to come. If nothing else, the lecture this morning, I think, highlighted the fact that the answer isn't just in sequencing our chromosomes. Mm-hmm. There's just an awful lot more to it. I can hardly wait to hear the lecture on the chromatin structure. I mean, I hope, at some point that's going to be the next thing, because I think that's very exciting as well. All right, well, I want to thank you guys very much for taking time out of your afternoon to come and do this podcast. And hope you enjoy the rest of your time here in New Orleans.
Thank you.
Thank you so much.
Thank you very much.
You have been listening to the ASN Kidney Week 2017 podcast. This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.